Anusha from Remedio to just tell us, so finally what will tie everything together would be a really good registry. For India, we may not be able to have a full registry like the NHS, but at least in small areas, like Dr. Prema Chande said, like in our own networks or district-wise or state-wise, how can we develop, what is the IT industry offering us at this moment for retrieval, recall, and connectivity between the stakeholders, including the patients?
ओके वो है मेरा प्रेजेंटेशन जो मैंने खोला था
ये वाला ना
um, thank you so much for the question and it's a great honor to share this panel with esteemed guests. Like Dr. Shobha, Dr. Kim, and Dr. Shailendras have already referred to the role of AI in assisting ophthalmologists and other healthcare professionals. I'll sort of build on what technology can do. And the major disclaimer here is technology is not here to replace physicians, ophthalmologists, healthcare providers. It's a tool to augment clinical decision making, specifically in areas where resources are constrained. In the interest of time, I might have to skip through some of the slides, so please do excuse me. So in terms of what technology can help is we can develop systems. One is the artificial intelligence system that many of you might be using in your practices, where AI models are trained to look at specific markers in the retina and identify diabetic retinopathy, glaucoma, age-related macular degeneration, and we're also looking at models that are there's early research to indicate that there are certain changes in the retina that can also predict cardiovascular disease as well as chronic kidney disease. Now, in terms of what technology providers tend to do, specifically those who are intentional about working at the last mile, is we develop technology for the people and the community in the last mile, as well as healthcare workers, specifically frontline healthcare workers, as well as non-physicians, to be able to use technology that's portable, that is designed on principle of human-centric design. What we do is also make this technology like robust, so that it's able to be carried to remote areas. It's internet independent as well as it's battery operated. I'll skip some of this. So so there were certain questions raised earlier around regulatory approvals, as well as the current frameworks that is available in terms of how AI is governed specifically in India. So we're very happy to announce that Remedio's diabetic retinopathy AI is the first one in the country that's been approved by CDSCO. And we are happy to share that we were one of the early partners in terms of also working with the government to help guide some of these frameworks. And this is some of our some of our reports, which what we do is, there's extensive clinical validation. We do prospective trials to be able to compare the AI results with clinical gold standard. So for the referable diabetic retinopathy, so there are extensive studies done in tertiary community settings, secondary care settings, and the AI then classifies based on referable conditions. Similarly, for glaucoma as well as AMD, we do similar gold standard studies. Now coming to the ethics and the ethical frameworks of AI implementation. So there's something called machine training. Yeah. Yeah.
Just tell us about the database, if
Sure.
possible, because that was the. Yeah, thank
So
you.
now coming to how we can integrate patient workflows. So we do need a registry like similar to what an Ayushman Bharat Health and Wellness Center registry can provide, which is you do have NCD screening data that does exist. So a lot of what we can do is integrate with existing government systems that do have the diabetic registry. In case of standalone private or non-profit organizations, we do have a database we do have access to database where there is an integration that can happen. So for example, here you'll see that you'll have like different sites that's accessible. And then you can actually plug in and look at individual patient data. That also allows you to look at fundus images at a patient level as well as at a facility level. And you're also able to access the reports. And this is an example of a Rotary-led program in Karnataka where they track the patient. So there's interoperability between our system as well as their EMR. So this specifically was designed for the diabetic retinopathy and glaucoma screening itself, where you can actually look at the patient the diagnosis at the time of the first point of contact, as well as there's options for you to look at follow-up. So essentially, there are existing data infrastructures that are in place, and technology providers can enable communication between different data systems, as well as ensure that the
Thank you.
patient
Thanks.
is able to get
Anusha?
treated. Yeah.
Yeah.